You are experiencing the Knuckleheads of Liberty podcast.
It is August 26, 2024, and welcome to the Knuckleheads of Liberty, where we are bringing you the people and the organizations fighting for liberty around the country and in your region. And today we have a special show for you. We have the Citizens Council for Health Freedom, and so we're going to be talking about a lot of free market medicine ideas in this particular show. But before we get into any of that, let me introduce you to the panel. In our upper left-hand corner, we have Leon the Word Brathwaite, last word in Liberty. He is a retired engineer in the state of California. In our upper right-hand corner, we have Twila Brase, our special guest today, and she is the president and co-founder of the Citizens Council for Health Freedom. And my name is Jason McPhee. I'll be your host today. So before we get into that, we always like to make our announcements. And so I wanted to just remind people that Constitution Day celebration is coming up here in in Folsom. So if you're local, you might want to check that out on September 15th. In fact, we'll have a show next week that focuses more on that. And Leon, maybe you could bring up the visual on that just so people can see it real quick. So that is going to be a big celebration out in the park. So it's certainly something you can bring your family to. And also to our Freedom Fest show, where we actually interviewed Twila as well there briefly. That's gonna we're hoping that will be ready to drop next week. So after we get done with all our video edits. So I guess we're about that's enough for the announcements. So we're going to spend most of the show talking with Twila about her organization. But before we do that, what we always do, we start out with a Liberty quote of the day. And so I picked one that I thought was really appropriate for what we're going to be talking about today. And the one for today, and Leon, maybe you could bring up the visual. It is Mr. Milton Friedman, and he had some thoughts also about the healthcare system. And one quote he had from an interview that he gave, he said, "We have a socialist communist system of distributing medical care. Instead of letting people hire their own physicians and pay them, no one pays his or her own medical bill. Instead, there's a third-party payment system. It is a communist system, and it has a communist result." I thought the word communist seemed a little hard because we are all paying for our insurance, but the point he's trying to get at is the price signal's dead in medicine. I mean, we pay these insurance companies, and then we just all crab about the prices. And we wonder why they keep going up, but nobody's really making any decisions based on price signals. What do you guys think about this quote? I think it's a fantastic quote for the most part.
Twila, you can go. You can go.
Sure. Well, that's absolutely where the healthcare system is going. It is socialist. I look at the healthcare system of today, the health plan, as the corporate version of socialized medicine. They control the data, the dollars, and the decisions. And so I think they're just in cahoots with the government as it is, and get a lot of money from really being allowed to run the Medicare system, the Medicaid system in the states, and really being the favored option for coverage, even though they aren't true insurance. They're like legally, they're known as prepaid health care. So it's very much like a socialist system where you pay all this money and then you hope that there's going to be health care for you in the end, medical services.
All government programs, all of them, socialism in one form or the other. Healthcare is probably the worst of it we have here in the United States of America, because everything, like price signals, virtually don't exist at our level. Like, for instance, I went to the doctor last week. I saw the doctor. I don't even know what the hell I paid for it, quite frankly. I know my insurance company is going to pay for it eventually. I don't know what I paid for his services. And these are the kind of things that's going on. That's what happens in a socialist system, because you're always lining up, you're always waiting for services, and you don't know what you're paying for those services. And this is a real problem. So Milton Friedman is absolutely right that this is a socialist system, and you have a socialist outcome, or the services is always rotten at some points in time, but the outcome is preordained, as long as we're going to stick to this socialist communist system of distributing medical services.
Yeah, and we keep sliding down that path too, farther and farther, as we'll talk about a little more later in the show. More
Indeed.
people keep on wanting to get more government in there, and throw more money at the problem. So, but I think now's a good time to jump into the Citizens Council for Health Freedom, and so start talking about that. So, I'm bringing up their webpage here. It is cchfreedom.org. So definitely, if for some reason you leave the show early, you can go find out more about it on there. Twila has a lot of great videos, and they even have a podcast too, I think. So, but let's ask Twila. So, do you want to tell us a little bit about Citizens Health Freedom, what it is you guys do? Well, in fact, I have a short little video intro. Let me show that real quick, because that kind of hits the nail on the head, and then we'll let Twila start expanding upon it. So, Leon, that is KOL video, KOL number 1.
My name is Twila Brase. I am president and co-founder of Citizens Council for Health Freedom. We are a national, nonprofit, nonpartisan, free market, patient-centered organization. Our mission is simple and to the point. We exist to protect patient and doctor freedom. This includes protecting patient privacy. As I like to say, he who holds the data makes the rules. Before this organization began, I specialized in pediatric nursing. However, when President Clinton decided to take over the healthcare system, I helped to start this organization, and we have been fighting for health freedom for over 2 decades. Today, 70% of doctors are employed by powerful outsiders who use the government electronic medical record for surveillance and control.
So that's a shorter part of a longer video. So I definitely suggest you go check that out to see the rest of it, because you can find out all the things they do there. But Twila, tell us more about what it is that the Citizens Council for Health Freedom does.
Well, we are a policy organization, so that means we spend a fair amount of our time talking with legislators at the state level and members of Congress. So we visit Washington, D.C. and have meetings. We also are working with about, I think right now, it's 8 different states with legislators who are looking for free market, pro-patient, pro-privacy legislation that they could put into their state. We also do a variety of programs to try and bring the entire country away from the socialized medicine abyss and bring it back into freedom. But before we can even do that, we have to help people protect themselves in the exam room. So that's part of the reason why I wrote the book, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records, to let people know that all of that data collection in the exam room, they do not have to participate in most of it, and how to say no. Or like the COVID, we had a COVID guide. And so we had more than 150,000 people around the country downloading that. And that was just from our site. And we did COVID videos during the first 2 years of COVID, and to tell people, here's the truth about what's actually out there. Ignore the mainstream media, and let me just show you the studies and the comments of people who really know what's going on. And so we had people from all around the globe. We'd get comments from New Zealand or Ireland or wherever. So, we are trying to stop socialized medicine in this country and bring back a free market system of freedom. And so we use both policy, programs, creativity to try to move the needle in the direction of freedom and away from tyranny.
So Twila, I'm sorry, Jason.
Well, I just wanted to point out the book that was this is something you published in 2018, so it came out right before the whole COVID pandemic, I guess. Mm-hmm. And your background is you were a registered nurse, I think. Maybe you could tell us a little more about your background, I guess, well as how that ties into the whole medical system.
Sure. So I am a registered nurse. I have not been working in the care setting for the 30 years that I have been doing policy, but still use my experience and expertise in nursing as a part of what I do. I was originally an emergency room nurse in a pediatric hospital. So I took care of a lot of children in urgent and emergent conditions and times of their life. Then I became a school nurse for better hours, but I learned government bureaucracy in the school system, and then I started doing this work about 30 years ago. As soon as the Clintons decided that they were going to take over the healthcare system, I realized if they did that, then they would take over the country. And I think what you have seen with COVID is just how the healthcare system can be used to take over the country, to shut it down, to impose mandates, unconstitutional mandates. That's how healthcare can be used. And so for 30 years, we've been trying to move the country in a different direction than it's been going for about 80 years. So yeah, it's been going that direction for a long time, but people haven't really seen it.
So you and your organization have been doing this for about 30 years. So could you tell us a little bit about what successes you have had in trying to push us more to a free market where freedom is the predominant force, so capitalism is the predominant force in the marketplace in terms of the distribution of medical services?
So originally we were just in Minnesota because, the Clinton plan went away, but it really never went away. And it took a little bit for me to actually learn policy. I remember I was a nurse coming out of a care setting, realizing I needed to do something. And
yes, it's like the patient was the entire system at that point, right? You realize there was a sickness going on.
Right, exactly right. And so, at least in the first 3 years or so, I was learning about how strong the federal government was involved at the state level. I learned that because we in Minnesota had a Clinton-style law passed here, that a lot of the people who did it in Minnesota were being called by Hillary to Washington, D.C. And so then we really expanded from having a focus just on Minnesota to also at the federal level. And then over the last 5-6 years or so, we have been looking at how to impact the rest of the country. So we've been national for a long time, but now we're really going after state legislators. And so as one of the successes, I'll say a success in Minnesota was we stopped the initiative of a Republican to let the state of Minnesota Health Department determine best practices. And if a doctor followed the way the government wanted them to practice medicine, then they would be exempt from being charged for malpractice. So that was that best practices initiative. We shut that down with people all around the state who got wind of it and signed our petitions against it. At the state level, most recently, we just worked with Senator Daniel Zolnikoff in Montana to write the most powerful, most privacy protecting genetic privacy law in the country. That passed in June of last year, 2023, and became law. At the federal level, it's very hard to move the needle at the federal level.
Yes.
But we have, in 2014, we did get a temporary law to stop researchers from being able to access the stored newborn DNA that some states have been storing for years and years and years without parent consent. This is an issue that we discovered in 2003. In 2014, we got a temporary law to keep federal researchers from getting access to it. Then through a whole deception of the NIH, they got rid of that law, and now federal researchers can have access to it. So we're working at the state level to stop the states from being able to collect and store that data and share it. And then I guess the other federal win that I'll say is in 2019, right before COVID struck, we got an executive order from President Trump that would let seniors opt out of Medicare without losing access to their Social Security benefits. And a lot of people certainly do not realize this. But the Clintons in 1993, and nobody knows exactly who did it, but the Clintons in 1993 put into the operations manual of the Social Security Administration that if you do not enroll in Medicare Part A, at least, if you do not enroll in Medicare Part A, you will not get access to your Social Security benefits. This is not a law. This is not a published rule. This is just something written in an operations manual, and it's been followed ever since. There was a lawsuit. Judge Kavanaugh, at that time in the appeals court, wrote a terrible decision, which was countered by a brilliant dissent. But nonetheless, the U.S. Supreme Court refused to hear the case as a result. So in 2019, we got an executive order from President Trump to do this very thing, to allow people to opt out of Medicare and get their Social Security benefits. And but unfortunately, COVID came, it intervened. And then President Trump was not reelected. And then President Biden rescinded the executive order. At the national level, though, we do have a bill in Congress called the Retirement Freedom Act, which will do the same thing. And we're trying to get more and more sponsors onto that bill.
I see. So let me just out of curiosity, and I don't want to go too deep in the weeds on this particular issue. Are you all at all involved in the issue of medical transition of kids in terms of the transgender issue? Are you all involved in that in any way?
Not a whole lot. We have done public comments on some of the proposed rules having to do with that, having to do with not discriminating against people by allowing them to have this. And so we oppose those rules. But for the most part, we have left that issue to others who have it as like one of their lead issues.
Okay.
Yeah, because I imagine every issue when it deals with children always starts to get a little bit complicated. One of the things I guess that I wanted to, one of the things you touched on too that might surprise some people is that this is a problem from both sides of the aisle, because you were talking about how, you're having to stop people who are, not just maybe, big government Democrats, but maybe some kind of big government Republicans too, who want to get in there and make decisions for everybody. So this is definitely a both sides of the aisle type of thing you guys have to keep your eyes out for. That's kind of what I'm taking from you.
Yes, well, we're nonpartisan, and in Minnesota, where we do the majority of our testifying, although now we have testified in Montana and Wyoming and Nevada, I believe. We in Minnesota, we are known for the fact that we will testify against Republican bills, and we have occasionally testified for a Democrat bill when they were on the right side of freedom and the Constitution.
Well, one of the things I wanted to get back to is because you talked about Clinton's plans that wound up getting you energized, but I guess, this goes back a lot farther than that, right? The idea of how much government really is sort of working its way into healthcare. And what's kind of the background story of that? Is it like date back to World War II era policies? How far back do we have to go to see government creeping into our system?
So President Truman was the first president who really advocated for a national healthcare system. And he didn't get it, obviously. And actually, I read a book about him, and I expected not to like him. I really liked him, but he was really wrong about that. He might have been wrong about other things too, but he was a unique individual in how he even did the business of being a president. So then along come the unions who tried to get President Kennedy, to give us a Medicare system, right? Because they decided that they would start with Medicare, get the seniors in first, and then eventually they would get to a national health system, national health insurance system. And Kennedy did a very, I should say, I'm sorry, I do need to go back just one little piece here. In World War II, you're correct, it was like Truman, and then, but World War II also is when Congress did wage and price controls. And so employers wanted to figure out how they could compete for employees, and they asked for permission to offer health insurance. And then within about 12 years of Congress agreeing to do that, they codified it. So they put it into law and they made it tax deductible for the employers. And that was really the beginning of capturing people into groups. And I do mean capture. And so that at that point, employers often would offer different types of health insurance options for you. And, for people who are listening to this, who have been around a much longer time, they would remember the fact that they had a whole panoply of insurance options to pick from when they came to a new employer, or even, for re-upping insurance, right? But now, today, we only really have one, and it's really only a health plan. And that happened because one, because of employer-sponsored coverage that grouped them in, right? And then Medicare grouped all the seniors together when that happened in 1965. And then when the HMO Act of 1973, that was Senator Ted Kennedy's plan, that created the HMO, which is now the health plan. And then you move forward from there, and we have, I believe it was in 2003 when Medicare Advantage became law, and then in 2010 when the Affordable Care Act says you could only have a qualified health plan, and all traditional catastrophic indemnity policies were banished. And made illegal after the age of 29. Nobody can sell anyone a catastrophic policy after the age of 29. And so that's how we have come to where we are, with the government favoring the health plans, using the health plans for Medicare and Medicaid, and really forcing us to have those unless we happen to be in a healthcare sharing program, healthcare sharing ministry. Those people who are in a healthcare sharing ministry don't have to be in a health plan, but they are only about 1.5 million people in the entire country.
Well, I had a few visuals, and sorry, Leon. I just wanted to bring up these visuals because part of this issue of trying to control costs and price controls and then push everybody into insurance, it does a lot to how much we wind up spending and covering. So, Leon, maybe you could bring up the visual real quick. So this is this is a website where they're tracking the amount of government spending on healthcare, and so you can see this goes back to like the 70s, and the number for the total health expenditures is really small, and then they track it in 2022 dollars. But so less than a half of $1 trillion in 1970. Now we're up to like close to 5 trillion. We're really getting to, and so I mean these numbers are really getting quite scary. It keeps growing and growing as a part of what we're doing. And I kind of think part of this might have something to do with that whole insurance thing where you're saying that, way most people insure themselves. Like if you insure your house, you insure for a catastrophe. So if something unforeseen happens, it's going to wipe you out. You don't insure to have your fence painted, or your, lawn mowed. Right. And that's kind of where we've gotten to with healthcare, right? I mean, you're getting insured for every little thing. And so you have a third party involved in every part of the equation. I guess is that really the real ill that we're seeing here on the insurance side of things?
Well, I think that the real ill is that, yes. But to say that in another way, it is the fact that there's third party payment for medical services. And so when you have somebody else paying the bill, it's like going to the restaurant and somebody says, well, pick whatever you want. I'm paying, right? And then you have to decide, are you going to are you going to order what you really want? Or are you going to, because that person's looking at you across the table, are you going to buy something that you think that person will be agreeable with? But when you're in the exam room and somebody else is paying the bill, that person isn't in the exam room with you. And that person isn't at home when you're making your appointment. You're not thinking for the most part about what it will cost you. Although, I will say that now, because of the Affordable Care Act and the high deductibles, more people are thinking about what it will cost them. But they have so much money has been taken from them through the Affordable Care Act because the insurance is no longer insurance. It is prepaid healthcare. It covers and looks at everything. It's not there just for the catastrophes. But you are paying, even though you have a huge deductible, you are paying a huge premium. So this is like the Obamacare scam. Before, when you had indemnity insurance, and you might have had a deductible of $10,000 or $5,000, but the amount of premium that you paid was really small. Nonetheless, that system, you paid a small premium, you had a large deductible, and you were very cost conscious about what was going to happen before you reached that $10,000 deductible. But you knew if you got cancer, or if you became comatose for whatever reason, that policy was there to protect you from financial ruin. Today, the health plans and the cost of the deductible plus the premium can actually put you in financial ruin before, just by the virtue of the fact of how much you're having to pay every month. It's really not health insurance. It's, like I said, it's the corporate version of socialized medicine. You're paying a lot for it, not in taxes, but in premiums.
Yeah. And here's a couple other visuals too, Leon. Can you bring back the visual real quick as well? But this also shows the percentage of GDP, and that's shocking as well. We saw how it was progressing in price, but here we look at 1960. This is a chart that Statista has put up, and it was around 5% of the country's GDP in 1960. Today, we're just hovering right around 20%. And if we compare how that looks to other countries, United States, it's funny. I mean, other countries have gone more in on socialism, it sounds like, and yet somehow we've managed to outspend them all as a percentage. So it's kind of weird in this odd system we have at the moment. So sorry, Leon, if you wanted to jump in now, but we are going to have to break in a little bit for public access.
Yeah, I just wanted a small clarification, Twila. You said something about healthcare ministries. What are those you're speaking about?
Healthcare sharing ministries are they are an exemption in the Affordable Care Act. So you do not have to remember when you had to show that you were insured, and it was a mandate, right? They did not have to show that they were insured because they were part of a healthcare sharing ministry. And a healthcare sharing ministry is a ministry that allows people to share each other's expenses, medical expenses. They all have their own rules. They all function differently. There's about 107 of them across the country, but there are really maybe, 5 to 10 ones that you could consider major, like Samaritan Ministries or Medishare. And so you pay your monthly share either directly to a family or to some kind of an escrow account, and then all the medical expenses of all the members are shared every month.
Sorry, let me break in here. If you're watching on public access, you'll have to catch the rest of the show online. We got a lot of fascinating things to talk to you about and things to discover about this crazy healthcare system we have right now and reasons to have it changed. So I guess, one of the things I think maybe a lot of people don't realize is how does this actually work out in consequences as you start moving more and more of this stuff towards socialized medicine, and how do the costs keep adding up? And we talk about some of the difference between the states, and I didn't want to dive too deep into this issue, but here's just one that California recently threw on top of the whole pile of covering, of getting things into government healthcare, and it had to do with migrants coming from other countries. They've guaranteed healthcare, and you're seeing some of this happening in other states as well. But we have a really short clip for California, and it talks about the cost, and it's kind of eye-popping. So, Leon, it is KOL 4. Can you play video KOL 4?
California has become the first state to guarantee free health care to all low-income immigrants. It's part of Governor Newsom's operating budget, which pledges to make all low-income adults eligible for the state's Medicaid program by 2024, regardless of their immigration status. Nationwide, low-income families get free health care through Medicaid, but the federal government doesn't pay for people who are living in our country illegally. The move will cost about $2.7 billion every year.
So that's $2.7 billion. That's not from the federal government. That's just for the citizens of California to pay. It's yet one thing after another that gets thrown on. Are there a lot of other kind of state programs like that running around in other places where they just keep on throwing more and more things on the pile?
Well, we have not tracked that issue, although we know there are other states that make it available. But we also know that there are all sorts of other mandated benefits that states keep adding to what health insurance in their state has to pay for. And all of those mandated benefits, the last time I looked at it, it was something like, I don't know, 0.25 or up to 1.5% increase in the premiums of health insurance premiums, depending on what kind of mandate it was. Now, by adding illegal immigrants, you're just adding to the total cost of the program. And I do know that that is something that both when we look at the presidential candidates, there's been very much a statement about from both sides about illegal immigrants. And on the Kamala Walls side, they have both said that they believe healthcare is a human right and that healthcare should be funded for illegal immigrants. On the Trump-Vance side, Vance in particular has said absolutely no care dollars for illegal immigrants. And I think that Trump has said it as well. So anyway, it is definitely an issue because look at all the immigrants that have come in. And the fact of the matter is these are either going to result in higher premiums for private coverage or higher taxes in public coverage. If nothing is free, that whole thing about Newsom is providing free coverage. It's not free.
Yeah.
I mean, maybe they don't have to pull out their pocketbook, but it's not free.
Yeah. Well, in economics, one of the issues too is that if you try to make something free or bring the cost down below market price, there's other spillover effects too, and one of those that we see is lines within. So if the price doesn't completely go up, then maybe your cost in time and maybe that. It could be your life too, waiting in line for medical care. And Leon, could you bring up the visual? Because we always hear people talk about, why can't we be more like Canada? Why can't we be more like Canada? Well, here is something put out by the Fraser Institute. And they talk about wait times and how that's changed in Canada over time. And in 1993, they had average wait times of 9.3 weeks. That's ballooned today to almost 6 months. 6 months to wait to get to that point where you're with your specialist and getting treatment. And, that could be, some life or death stuff. And that's the average in Canada. There's some places apparently where it can be a lot closer to a year that you're waiting, which is absolutely insane. But I mean, this is part of the problem, right? And you see this with concert tickets. If there's a concert and everybody really wants to go and the price doesn't reflect that, you get a big line waiting for those tickets. So that's kind of the same thing. So Twila, is there? Well, in fact, we even have a short video on this Canadian thing from a guy named Aaron Gunn, and it's a real short snippet, but it kind of shows what the cost of life is in that. So Leon, can you play this? It's KOL 3.
More than 13,000 Canadians. That's how many die each year languishing on healthcare waitlists in Canada. That's the shocking new headline number from secondstreet.org, which compiled the data from various health authorities across Canada and includes those who died waiting for elective procedures like hip replacements, critical diagnostic scans like MRIs, as well as life-saving surgeries. And when you dive into the numbers, what you find should be a cause for concern for every Canadian. According to the province of Nova Scotia, for example, who provided the most accurate and detailed information for the report, nearly 10% of those who died on a healthcare wait list were waiting for surgeries that could have potentially saved their lives, and 60% of them had already waited longer than the recommended maximum wait time.
So free healthcare if you can get it. But I mean, just one of the many spillovers of sort of socialized medicine. Twila, this kind of, your experience in seeing what happens when we try and throw too much government into it.
Well, if I may just interject for just 1 second, we started this program with Milton Friedman and his quote. It was he who said, "There's no such thing as a free lunch." Okay, anyway. Go ahead, Twila. I'm sorry. I just needed to say that.
So I think, people who are looking for care today are finding that they are waiting longer. And one of the reasons that they're waiting longer for sure, which hasn't been mentioned yet in our little conversation here, is the fact that as we move more towards a government-run healthcare system, where Medicare controls everything happening in the exam room, and it does, no matter what your coverage is, it does. I could say more about that, but anyway, because there's so much control on the doctors and there's so much record keeping, that there's a lot of doctors and nurses who are leaving their professions. And when they leave their professions, it means longer wait times for you. It means less availability for the surgeries that you need because they have to have a certain amount of staffing in the OR or staffing on the floor. It just means longer waits. And indeed, people are definitely finding that. I know that during COVID, 100,000 nurses left. And they do say that there's about 40% of physicians that are looking for retirement. I believe in the next, is it by 2030 maybe? I don't have that as a good statistic, but there is 40% that are looking toward retirement. I just can't remember when.
Well, and that was something too, where a lot of these people were also forced out as well. I understand, because they were telling people they were forcing some people to get the jab in certain industries, and that was one of them. And so some of the people just chose not to do that, especially because some of them already caught COVID, but the government had a mandate where they said, "Hey, there's nothing better than this new mystery vaccine that we've developed."
Even
matter
natural,
if you
yes, even natural immunity was inferior to the jab. Could you imagine that?
Yeah, that's true. There were a lot of them who very wisely decided not to take the jab. Now, some of them, it was very difficult for them because they needed the job, right? And so some of them stayed, and now they are, vaccine injured, if you want to call it a vaccine, which it really isn't, right? But so, yes. And so those who are injured are also not available to take care of patients because they are at home trying to recover, 3 years after the shots began.
Well, Twila, one of the things we like to ask people, and maybe this would be a good point before we jump in on maybe a few more of those COVID questions that have maybe shaken trust in the system. But I did want to ask you about, for a lot of people, what is it that wakes them up to the problem? Because, obviously it's not public schools. They're oftentimes are telling kids that, hey, government, it can be the solution to a lot of problems, but oftentimes you have to find some other path, like Milton Friedman's Free to Choose or something. A lot of people, maybe that was, for me, that was part of the path of waking up to a lot of this. But what rang your Liberty bell? What kind of woke you up to a lot of these issues?
Well, I like to say that I have had a freedom bone since I was born. And very, very early, I was writing little things about freedom. I realized that it was amazing that I was born in America. I could have been born anywhere. I just saw it as a privilege from very, very young. I did art from very, very young that was very pro-America. But I really never followed politics or policy until the Clintons decided to take over healthcare. And then that freedom bone really started to move. And I thought, oh yeah, if they take over healthcare, they'll take over the country. And then I never looked back from that point.
Freedom bone sounds like a critically important organ in every body.
But
a lot of people are missing it, apparently.
Obviously. But I'm a little bit curious, Twila. So you say you like virtually born with this freedom bone, shall we say? I mean, that's a very fascinating thing to say. I mean, was it that you grew up in a household where freedom was a big deal? Or, I mean, I just don't understand how you. I mean, was this embedded in you as a child or something?
I don't think it was really the household because I don't really remember a lot from the household. I just feel like, God put it there. And I didn't, when I was given the choice of an art project or a poetry project or whatever, I often wrote about America. And I can't relate it to something that I grew up with. Not like the family didn't believe in the country or anything, but it was nothing that was like raging out there that I can even remember.
Oh, okay. That's it. That's right. I just find that so fascinating to. Wow. Okay.
Well, one of the things we've kind of touched around, and certainly it's been a big issue for every liberty issue, I guess, and that's what happened during COVID, but especially since it was tied into the medical establishment. But and it seems like that's really shaken, maybe even woken up a lot of people about what's some of the problems are with our system. We had a lot of, I guess, questionable things out there. I guess that they used to sort of kind of like that Ben Franklin quote, sacrifice a little bit of your liberty for a little bit of security. And of course, this time it was sort of health safety, and you just give it all up. But I did want to show a few videos on some of these things, because we saw over and over again how both the government and their sort of, I guess, their partnership with big corporations sort of work together to undermine a lot of our health. And here is KOL 5, where we actually have a health department talking about how it is that they counted these numbers. And I thought it was kind of interesting, because we heard how terrible the numbers were, but if you really start to think about how the confusion in the counting, I'm not even sure if we're still sure of what we saw that happened. So Leon, you play KOL number 5. This is Chicago's or Illinois' health department talking about how they counted the COVID numbers.
I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
So right away, we're seeing that, hey, it's like if you were in a car crash and you had a bottle of water, maybe you drowned. I mean, it's just kind of, to me, right away, just how we even counted things that affected policy was a big question mark. What were you seeing as a sort of a health professional, and that somebody with that kind of a background? What were your thoughts when this whole thing? Because I know you guys put out some of your own information for COVID that maybe bucked the system just a little bit.
Oh, yeah, I did every twice a week for basically 2 years. So I was so grateful to that woman because she told the truth, and I was so grateful to whoever captured it and made it available for all of the rest of us to see. The other things that you could see that showed how ridiculous the numbers probably were just the instructions from the CDC of how doctors were supposed to label the death certificates, and that you didn't have to know that it was from COVID to actually list it as COVID. You could presume that it was COVID. And so absolutely not. We have no idea how many people died from COVID. There's all sorts of people who should have been labeled as died from mechanical ventilation imposed during COVID for lack of giving the right treatment to COVID, which would have been, things like ivermectin and other repurposed drugs. And certainly not remdesivir. We don't have probably many death certificates that say that they died from remdesivir. It will say that they died from COVID. But it was remdesivir that took away their organ function, and then killed them. So there's a lot about those COVID numbers that cannot be believed. It just can't be believed. It's not true.
Yeah.
I think we had a ridiculous case of a guy who had climbed up a ladder. I don't remember what state it was. He climbed a ladder. He fell off the ladder. But when he got to the hospital, they tested him. It turned out that he had COVID. He died from the fall, but they listed that as a COVID death.
Yes. And just like that Illinois woman said, I mean, she told the truth. A lot of these people in public health, they're not telling the truth. They're spitting out lies. They're fear mongering, and they still want to do it now with bird flu and everything else that they can to recapture that kind of control. But, the American public is a much warier American public. And as a matter of fact, even the public health officials are wondering how they can get back the trust that they used to have. Well, they don't deserve the trust. Now, that woman there, she probably deserves more trust than anybody else in the public health field, because she was asked a question and she told the truth. And, that is a very important thing, that every person who is a government employee needs to be telling the American public the truth, not trying to fan the flames of fear to get the public to do some nefarious agenda that the public health folks have come up with. This was just one big experiment to see how far they could go. And, even Deborah Birx, who was the head of the White House task force, she said several things that were interesting, or we found out several things. Like when they were talking about social distancing, right? They said they didn't have any science.
Right.
No science behind that. First, they came up with 3 feet, and they said, "Nah, let's just do 6 feet." There was no science. And then in July of 2022, she was on, I think, Fox News, talking about how they knew the vaccine was not going to work. She admits it in 2022. They knew. So we have just a whole cast and crew of public health officials spewing lies across the country, from one podium to the next, one press conference to the next. And this is why they should not be trusted, because they clearly have an agenda that is very against the American public, against liberty, against the Constitution, and against all the things that make this country great. They would be happy to just lock us all down, shut down the businesses, destroy families, homes, education, etc., for their own agenda. They should not be trusted.
Well, when you say too that from podium to podium, one of the funniest memories, I wish I would have taken a video of this for the show, but I'd forgotten to do it. But there were quite a few instances where they showed the public health official where he was caught on a camera before talking at the health podium, or at the podium to the public, and he wouldn't have a mask on. And then right before he walked on, he'd put on his mask and walk out. And then essentially assure everybody of how important it was to wear masks. In fact, we talk about the science in this distancing and the mask wearing. This is a meme I particularly think is just great because it captures it all. Leon, could you bring up this image real quick? It shows the airlines and kind of what was going on for anybody who was flying in that time. We all remember. And, here they forced everybody, because remember, it was 6 feet. Now, we didn't have any real science apparently about that, although they claimed it was the science at the time. But they forced everybody in the airport to stand 6 feet apart. And then until you got on the plane, of course, that rule went out the window, which is just absolutely silly. And it's like people were living through this, and so many of them weren't questioning this, which is just it's beyond belief. But we also have a little video excerpt of the science of the mask wearing and how that evolved too, and we've shown that before on the show. But it just shows to show our public health officials the way they will so brazenly just I guess recreate the science on the fly. And so Leon, this is KOL number 6. Can you show that one?
People should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. Wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. There are unintended consequences. People keep fiddling with the mask and they keep touching.
One mask is better than 0 masks. 2 masks is better than 1 mask. But you don't have to have double masks. Is that right? I mean,
it is.
And now we're hearing we should wear 2. Where do you stand on that? If I go to the grocery store, do I wear 2? Do I wear 3? Is it safer to wear 8?
One of the ways you could do it, if you would like to, is put a cloth mask over, which actually here and here and here, where you could get leakage in, is much better contained.
So if you have a physical covering with one layer, you put another layer on, it just makes common sense.
So that was, the evolving science of our leadership, our political leadership at the time. But eventually we did get a meta study out that from the Cochrane Institute, where they do a lot of, collection of a lot of these studies. And essentially they said, hey, look, let's see, I can't remember exactly where it is in here, but they said that these masks are not that effective. They couldn't really see much efficacy in them. And they said even the N95 masks, they said there wasn't really much evidence to show those were much more effective than just the cloth mask. And I mean, it makes sense because of what Fauci was talking about in the beginning of that video, that there's protocols that when you wear safety equipment, anybody who's worked in a laboratory knows. And of course, nobody had the protocols. Everybody just put a mask on, do anything, but we saw our government lying to us. And then Fauci coming back later and even saying that, oh, what I told you the first time was a lie, but I did it for the public good.
Yeah. He likes
I don't even know where he was lying, one or the other.
Yes, he lied to us for our own good. Imagine that. That man should be in prison. Quite frankly, he should be. Fauci.
So the interesting thing about all of this is we have the email from him in February 2020, where the former U.S. Department of Health and Human Services Secretary, Sylvia Burwell, I think her last name is Burwell, asked him. She said, I'm going on a trip. I'm going to be on an airplane. Should I wear a mask? And he said, absolutely not. All the virus can just fly right through. There's no reason for you to wear a mask. So that's one thing. But then when you also think about all those masks on the plane, okay, if this is a deadly disease and we must be 6 feet apart from each other and we could even shut down businesses, then how is it possible that for 15 to 20 to 30 minutes during the eat time on the plane, you could take your mask off? If it is a deadly disease, there is no way that you should spend 30 minutes spreading germs around everybody, because it's so deadly. You can't eat. You can't afford to eat, right? But they afforded people to eat. So it was just like ridiculous.
Well, on that same note, with restaurants, they had rules where you wear the mask in until you get to the table. Then you take the mask off. Magically, the COVID has a force field around the table.
Well, and Dr. Claire Craig from the UK, she's written a book called Expired. And she talks about the fact that there was a virus that was a hand, foot, and mouth disease virus that was on the mainland in some country. And nobody came to this island that was 170 some miles away. Nobody went to that island. But in the meantime, that virus went from the mainland 170 miles over the water, 30 some miles into the middle of the island, and people got animals got hand, foot, and mouth disease. And so she said, viruses float on the air, right? And so, the idea that you could have a mask on and this is going to protect you is ridiculous, because you're just breathing in viruses all the time.
And when you look, we don't have to get too deep in the weeds on this, but when you look at the ridiculousness, look at what they were doing in terms of businesses. All the large businesses, Walmart and all them, they stayed open, but the little mom and pops up, they were closed down. So this virus, apparently, according to them, it changes its characteristic depending on the size of the business. This was such ridiculous nonsense.
Well, and as if that has no health impact either. The idea that you shut down people's livelihoods, and not only that, you also tell hospitals essentially how they have to triage people, that okay, everything's about COVID now, and if you have cancer screening or something else, I guess you're out of luck. What's happening. So it's just horrifying.
So they still want people now today to take the latest booster, and I think I would commend to everybody who's listening that they should watch the Tucker Carlson interview with Brett Weinstein regarding the Darien Gap, which is in Panama. So in the last 6 minutes, Dr. Weinstein, who's a award-winning PhD biologist, talks about the fact that anybody who has had more than 3 COVID shots, their IgG4 level increases to the point that it essentially downregulates their immune system, which means that their immune system does not want to kick in when the next pathogen comes. So it has left people, he believes, vulnerable. And he's called it a firmware, that their immune system has had a firmware update, not a software, not something to be changed, but something permanent. Now, he said he hopes he's wrong. He hopes it's a mirage. because he said if he's not wrong, the American government better figure out how to neutralize the threat. Because if this is biowarfare, every biowarfare needs the population. Everyone who's doing biowarfare needs a population that's going to survive and a population that's not. And interestingly enough, he said that the Chinese never allowed their people to get a spike-based or mRNA-based shot. They did not require their people to generate the toxic spike protein in their bodies. And so they have never gone through what much of the world has gone through with the mRNA vaccines. So I would encourage, everyone who's even thinking about a booster to take a look at those last 6 minutes and see what they think about, moving forward or not.
Well, one of the things I wanted to also show, and this kind of hits on that point of what you're saying about the sort of misinformation around the vaccine and the idea that they told people that, hey, this was going to almost a bulletproof cure and you don't have anything to worry about. Fauci was going around telling people this, and we're seeing a lot of those people now are getting this, COVID multiple times over after we were told that they wouldn't. And Leon, we have a short video on that. It's KOL 9, but where he's trying to convince some people that this is an issue here. So it's a pretty short one here.
So you're actually protecting your family by getting him vaccinated.
Well, I heard that it doesn't cure it and it doesn't stop you from getting it.
No.
So
on the very, very, very rare chance that you do get it, even if you're vaccinated, you don't even feel sick. It's like you don't even know you got infected. It's very, very good at protecting you.
So that is just showing, hey, look, this is bulletproof. And here the president has gotten it 3 times. And of course, he's one of the most.
I got COVID after I got the vaccine. I got COVID.
Yeah.
The Cleveland Clinic did a research study on all of their 52,000 employees and came out with the research saying that the more COVID shots you get, the higher your risk of getting COVID.
Yeah, which is insane. And of course, we've seen Fauci himself has gotten it at least once that I'm aware of. I thought I'd seen it more than that in the news, but I'm not 100% sure. It's really hard to search for that. You'd be surprised.
Now he just got West Nile virus.
West Nile, yes.
I wonder why. Because, the thing is, if it's true that people who get the shot are getting, this firmware update, right? What else are they more susceptible to? I just, did he really get it? Did he really get the shot? That's one thing, right? But then if he really did he get all the boosters? And then if he did that, is that why he has West Nile and he ended up hospitalized for 6 days, I think?
Well, here's another part to this too that's nefarious as well, and that's the idea that this partnership with government and these corporations is essentially helping to keep us from being informed on this stuff. So, Leon, maybe you could bring the visual up on this. But here is the FDA. They were asked in a FOIA request, that's a public information request, to hand over some records on the vaccine data and sort of what the companies knew about it when they were developing it. They wanted to hang on to this stuff for over 50 years. So essentially, when everybody's gone, who's been forced to take this stuff. So, which I think is absolutely nuts. But this is the kind of partnership that we had going in. And I did have some other stuff I wanted to show, but I think we're getting short on time, so I didn't want to harp on this too much. But I think you can see that when we hand government all of this power and the news media is sort of echoing them uncritically. My gosh, we did have a clip I wanted to show too, but it was like where all of these Pfizer is sponsoring all these news episodes and stuff. So, I mean, you see, if they're paying them, why would anybody say anything critical about it? Why would journalists do their job if they're getting paid by Pfizer indirectly? So it just, but yeah. Anyways, it's kind of disturbing. But I did want to talk to you about your solution before we get done here to how we should be moving forward in the future, and it has to do with how do we privatize this? What are the ways we can do this? And so we have a video. It's KOL2, and I wanted to show how the Citizens Council for Health Freedom is looking at maybe possible paths forward for a real free market system. So I think this kind of encapsulates it pretty well.
I'm coming.
That's KOL2.
I'm coming. KL2, you said? 2.
Yeah.
In 2016, we started the Wedge of Health Freedom, an online directory of cash-based practices, including pharmacies. In 2022, we've gone even further. We are now building a new framework for health freedom in America. This framework will be cash-based at every level, including cash-based hospitals. It will also include true insurance, medical indemnity policies that pay the patient, who then uses the money to pay the doctor and the hospital directly. The patient is the point of the healthcare system. If the healthcare system does not work for the patient, it doesn't work. Our new framework is going to restore patient-centeredness, price transparency, affordability, and medical ethics.
So it looks like you guys have really been thinking about how we're going to get this process going. So how are we doing? I mean, I guess if somebody really wanted to take control of their own health, I guess where would they start with you?
Well, we would encourage them to look at the Wedge of Health Freedom, to the directory, this online directory, and see if they can find somebody in their neighborhood, or at least close enough that they're willing to travel. The other thing is, if they know somebody who is doing cash-only practices, tell them to join the Wedge. We really are wanting to bring every doctor in at the current level, or where they are now. There's probably about 20, maybe 2,000 more doctors that could come in, but they haven't yet come into the Wedge. And so we would like to find them all and have them in there and make them available to patients. The Wedge is free for patients, free for doctors. It's just part of our nonprofit mission to bring back, a real free market, affordable, patient-centered medical system that also protects your privacy in the exam room. And so, that's what we're looking for. And eventually we know that we need hospitals, and we do believe that, we can't really reform the current system. It's so corrupt and it's so embedded with government that we're building the parallel system. A parallel system of freedom that every patient and every doctor wants to be a part of. And so even though we're not trying to reform the current system, what we plan to do is pull the patients and pull the doctors and, pull other practitioners and pull all the power essentially out of the current system and bring it into a cash-based affordable system where the mission is returned. One of the things I like to say is that the mission of medicine has been taken over by the business of healthcare. This is not good for patients, and the only reason we have a healthcare system is for the patient. So we really do need to go back to a patient-centered system that doctors enjoy and have joy, because doctors today don't have joy, and you want your doctor to be really happy taking care of you rather than moving you along as though you're on a conveyor belt. So we are moving to something very different. We know that the big players won't like it at all if we really, really, really get it going. And but we do have some cash-based pharmacies already. We've got about 500 practices around the country, and we're just looking to bring everybody else in and then start drawing doctors out of the current system and bringing them into a cash-based system with real insurance. So we're working at the legislative level to bring back real insurance, which will really help the Wedge to grow.
Wow. That's really good. That's really good.
And as far as, I guess, people now, do you see a lot of people making that jump at the moment? I mean, are there places where people really can do that?
Oh, absolutely. We talk to people who go like 2 hours to to go see the closest doctor, to them, because they just want a doctor who works for them, not a doctor who spends 5 minutes or 15 minutes and follows the protocols on the computer, and it's in the door and out the door. And yeah, you can have a medication, but no, you don't really want to have time enough to figure this whole thing out, because that's what every patient needs. And so, yes, there are definitely people all around the country finding people really next to them, but also being willing to go further in order to find and use a doctor like this.
One of the things I just to bring it home as an issue, when COVID was first happening, I have 2 kids who were in elementary school, and they were trying to get everybody to take the jab, especially kids. And that was one of those things where, I could see that maybe if you're an older person, this, the risks, maybe you can say, hey, maybe this makes sense, maybe it doesn't. But for kids, there was no data to show that this was a problem. And yet they were trying to force this on kids. And when I went to my medical providers to talk to them about it, it was just the standard, whatever, the company line was on kids. And there was no skepticism at all. And that kind of disturbed me a little bit. And that maybe shows that, hey, maybe you really need a doctor who's in your corner and not just one who is, part of the beast, I guess.
Well, 77% of physicians today are employees. They have a boss. They are not the boss. It used to be that they were the boss of their own practice. They owned their practice. They had up their own shingle. It is government policy, is like the mandate to have that electronic health record in your exam room. That's an unfunded mandate. It's horrifically expensive. It forced all sorts of doctors to give up their private practice and sell or merge with a much bigger healthcare system. And really, all of this is, again, socialism, moving to Marxism, really medical Marxism, where the government controls everything, the doctors, the patients, the entire healthcare system. And then, of course, has you in their own coverage. And so that they decide what can be covered and what can't. And so, that's why we really can't reform the current system. We have to start a parallel system of health freedom.
Okay. Well, we're just about at the end of the show. And one of the things we always like to end on real quick is our Knucklehead Noise Patrol, where somebody said something really ridiculous out there. And I thought this was kind of appropriate since we're heading into an election and, maybe these choices will impact the future of our healthcare. I thought this was a kind of a funny story because it shows sort of the grasp of the numbers and the science, I guess. And here we have Kamala Harris talking about the number of people who she said died during COVID. And, you might think if she only said it once, maybe it was just a misspeak, but she actually said it a few times. And I thought this was kind of cool. Leanne, can you roll KNP number 1?
We are in the midst of a public health epidemic that has taken the lives of over 220 million Americans in just the last several months.
We're in the middle of a crisis caused by this pandemic that is a public health crisis. We're looking at over 220 million Americans who just in the last several months died.
So
wow.
we just, in case you don't realize it, if you're out there, the numbers, which a person who's running for president should know, the country only has a little over, it's right around 330 million people last time I checked. So according to her, we've lost 2/3 of the country.
Jason, you missed all those dead people who were piling up on the streets. You missed it all.
Somebody should have corrected her somewhere along the line, which says something about her own people.
Yeah.
Right. And to be fair for her, I did see another clip somewhere where she said 220,000 or at some point in the process. But the point is, she said this number several times, and it should have just rang to her the first time she missaid it. And so anyway, it's kind of disturbing. But I did want to give you a chance to say a few things about your organization again and where people could go, I guess, if they want more information. So let me bring up your webpage again real quick, Twila. Leanne, can you bring up the visual? So here is the Citizens Council for Health Freedom webpage. And where should somebody, I guess, leave you with a final shot here. What should people do if they want to get involved? Where can they go for more information, and how can they help out?
Yes, they can go to the web page, and there's a whole rotating thing on the top there, which gives more information about the resources that we have, as well as down on the bottom with helpful handouts, including our discharge instructions to help you in the exam room. So that web page is cchfreedom.org, cchfreedom.org. And if they want to go directly to the wedge and look for a practitioner, they can go to jointhewedge.com, jointhewedge.com. We also have the patient toolbox, which is a resource for making sure that you are protected in the exam room, that you can look at while you're there. You can see what the credentials are of whoever's in the exam room with you. How much training did they have? What does that thing APRN even stand for, on their tag? So that's at patienttoolbox.org. So we have a variety of things. You can get the book at bigbrotherintheexamroom.com, or you can also go to Amazon and other places and order it there.
Well, thanks so much, Twila, for joining us here, and just bring up that book again. It's Big Brother in the Exam Room. So you got the visual there for it, Leon. But yeah, definitely check that out. And if you're watching this show, and you're seeing this and seeing all the other guests we've had, be thinking about what you can do in your community, because we need all hands on deck if we're going to resist this push to take our liberties away that we keep seeing from people in power. So wake up, find out what you can do in your community. Maybe you can run for a school board position. Maybe you can start some kind of an organization. Maybe just start a club talking to people about issues like this with people in your neighborhood, to get the ball rolling and to try and move the ball for liberty. So thanks so much for joining us, and until the next time, stay tuned and stay free.
Oh, yes, indeed. Life, liberty, and the pursuit of happiness, always and forever.
Thank you for listening to the Knuckleheads of Liberty podcast. Find us on Facebook, Rumble, YouTube, your favorite podcast network, and at knuckleheadsofliberty.com.